In the next couple of videos, I want to talk a little bit about the drugs affecting the sympathetic nervous system, the sympathomimetics and the sympatholytics. I want to start in this video by giving a general overview of the structure of the nervous system, and then move on to looking at the functioning specifically of the sympathetic part during times of physiological stress. In later videos, I'll move on to discuss the pharmacology that is used to alter this normal functioning, focusing primarily on the drugs used to treat cardiovascular disease. So, let's start by considering the basic structure of the nervous system. We can firstly divide the system into our central and peripheral nervous systems. The central, or CNS, and the peripheral, or PNS. The central nervous system is composed of the brain and the spinal cord, and is essentially the processing centre for nerve impulses. The peripheral nervous system, in contrast, is basically every other part, being composed of all the peripheral nerve fibres that take impulses to the peripheral tissues from the CNS, and vice versa. We can further subdivide the peripheral nervous systems in terms of function, however, and we do this to produce the somatic and the autonomic nervous systems. The somatic portion is concerned with innervating skeletal muscles, and is therefore tasked with producing all of the body movements which are under voluntary control. This is a very broad area, and is a little bit outside the scope of this video series. The autonomic portion, we can therefore say, is the involuntary aspect, tasked with innervating visceral tissues, such as smooth muscles, and glands. At this stage, we can make another functional division, this time of the autonomic side of things, and we can break this up into I'll just scroll down a little bit. We can break this up into the sympathetic, and we can break things up into the parasympathetic side. These two really are the motor or effect aspects of the ANS, and it is worth mentioning that there is a third sensory branch which allows some degree of maintenance of these autonomic responses, feeding information back towards the CNS. By breaking up the ANS in this way, we showcase the idea of two opposing branches, each one undoing the physiological processes that the other one promotes. The sympathetic portion promotes the classic stress, or sometimes called the fight or flight response, whereas the parasympathetic side of things promotes the state of rest and digest. In this video, I want to explore the sympathetic portion in more detail and show its relevance to the pharmacological management of various different cardiovascular diseases. So, the primary purpose of the sympathetic nervous system is to allow the body to respond physiologically to stress. Primarily this is achieved through the interaction between specific receptor sites, which we call adrenoceptors, and a class of compounds that we can call the sympathomimetics. So what is a sympathomimetic? Well, really it's a group of compounds that groups a whole different bunch of molecules with similar chemical composition that either bind directly with an adrenoceptor, or can cause an increase in the concentration of the molecules which can do it for them, such as these guys. The most common examples of a sympathomimetic are a class of compounds called the catecholamines, and these are in your body already. This includes adrenaline and noradrenaline. These are but two examples of sympathomimetics, which are produced what we call endogenously within the body, but there are many similar compounds that are not naturally occurring or can be synthetically produced. Certain drugs, for example, which can also produce the same effects. We can call these non-catecholamine based compounds, and examples, far-flung examples can include amphetamine and cocaine, and these both have the same effects as adrenaline and noradrenaline, although usually much more potently. Adrenaline and noradrenaline can become bioavailable and therefore exert their physiological effect through binding with an adrenoceptor in a couple of different ways. Firstly, they can be released directly into the bloodstream as hormones after being produced by the adrenal glands, They can also be released from sympathetic nerve fibres themselves as neurotransmitters at what we call neuroeffector junctions, and then bind to adrenoceptors in the organs directly adjacent to them. The binding of a sympathomimetic to an adrenoceptor produces a variety of physiological responses that get the body into the fight or flight state. Let's just consider now these different effects by taking a closer look at adrenoceptors. So what is an adrenoceptor? Let's get a little bit of intuition behind this. Well, an adrenoceptor is basically what we call a transmembrane protein that sits in a variety of different cells. Here we have a smooth muscle cell, and when stimulated activates a series of intracellular reactions when it is bound with a sympathomimetic molecule, which I've got in both in pink and in green here. There are two main categories of adrenoceptor, the alpha adrenoceptor and the beta adrenoceptor, and these can also be further subdivided, but I'll look at this in greater detail in the next couple of videos. The binding of a sympathomimetic to an adrenoceptor in the cardiovascular system tends to increase both the rate and force of contraction of the heart, therefore increasing cardiac output, as well as causing a vasoconstriction of peripheral arteries, with the overall effect to increase blood pressure. And this is adaptive in times of stress, as it allows blood to be directed away from the highly vascular organs such as the kidney towards the less well-perfused organs such as skeletal muscle, which more really requires it. In the lungs, however, stimulation of adrenoceptors produces bronchodilation of the air passages, which again is kind of intuitive, as it allows an increased flow of oxygen to the actively respiring tissues, such as skeletal muscle, but also towards the brain. And another big effect of it is to increase the mental alertness, and this is by direct stimulation of the central nervous system. Other effects include promotion of glucose and fat breakdown, leading to a hyperglycemia, which again is fairly intuitive, as you want to have adequate blood sugar levels in order to fuel the various physiological processes which we stimulated. Being specific in describing which adrenoceptor that we're looking at, so whether we're looking at an alpha or beta adrenoceptor, can be of great importance in drug prescription, as it allows tailored prescribing of the agents that promote only the desired physiological effects, and therefore reduce all the unwanted side effects by stimulating the other receptors. But I will come on to look at this in much more detail in upcoming videos. So to recap, the sympathetic nervous system is involved in promoting the fight or flight response through the binding of sympathomimetics, the stress molecules, to specific receptor sites called adrenoceptors. These are present on a variety of different body tissues such as the heart, lungs and blood vessels. There are two main types of adrenoceptor, alpha and beta adrenoceptors, and these can be further subdivided based on their physiological effects and the tissues in which they sit. In the next couple of videos, I'm going to talk a bit more about the pharmacology of the system and its use in managing a variety of different cardiovascular pathologies. I'll go through the pharmacokinetics and the pharmacodynamics of the common drugs used in this system to treat cardiovascular disease, and go on to look at the common adverse drug reactions and the relevance to clinical practice.